Welcome to the COVID-19 vaccine clinic. You'll be receiving your mRNA Pfizer vaccine today, which is currently recommended for all patients under the age of 60. As the situation with the COVID vaccines and the COVID landscape changes, the information about the COVID vaccines will sometimes change, and therefore check with your vaccine provider about the most up-to-date information. Current data shows that the efficacy of the Pfizer vaccine is about 80 to 90% effective in preventing symptomatic COVID-19 infection. And it also shows that it is about 90 to 95% effective in preventing death, as well as severe disease requiring hospitalisation. There are 2 doses of the Pfizer vaccine. Ideally, the second dose is given 3 weeks after the first vaccine. In certain circumstances, this second vaccine may be delayed up to 4, 5 or 6 weeks, depending on the circumstances. However, be reassured this does not affect the efficacy of the vaccine. Once given, the vaccine takes about 7 to 12 days to become effective. It is given in the upper arm, so in the deltoid region here. So if you're wearing a jacket or a jumper, please take these off in readiness for receiving your vaccination today. Now, let's talk about side effects. Side effects can range from mild to severe, and up to potentially 50% of people can develop one symptom or side effect from the vaccine. You can't develop cough, runny nose, or throat because it is not a live vaccine. However, your body thinks it's fighting something. So symptoms that you can experience include things like fever, chills, headache, muscle aches and pains, tiredness or lethargy. You can also develop a bit of a sore arm, sometimes redness or swelling around the site of the vaccination. And in some rare circumstances, you can also develop some swelling of your glands. So if you're a female, it is recommended that you don't have a mammogram within 6 weeks of having your vaccination. Now, the TGA would really like to know about any side effects that you get, especially any unusual side effects. So it is important that if you can document these side effects, report them to the TGA on either the website or the phone number that's supplied. As with any vaccine, anaphylaxis is always a potential risk, although a rare risk. And that's why we ask you to wait for 15 minutes after you've had the vaccine for observation. Now, if you've had an allergy to another vaccine in the past, in particular if you've had an anaphylactic reaction to a previous vaccine, then you may be asked to wait for 30 minutes rather than 15 minutes after your vaccination. If you have a previous documented allergy to a substance called PEG or polyethylene glycol, which is in the Pfizer vaccine, you cannot have the Pfizer vaccine, so please make sure you let your vaccination provider know this. Now, adverse events can sometimes happen with vaccines, as they can with any medications. The one that's most recently been associated with the Pfizer vaccine has been the incidence of heart inflammation known as myocarditis or pericarditis. The incidence of this is about 1 in 25,000 or 40 per million people, and we have this data from the US at the moment. The data from Australia is currently still pending. Typically, these conditions occur 1 to 5 days following vaccination, sometimes out to 10 days, but typically in those first 5 days. So if you were to experience any chest pain or palpitations or shortness of breath or fainting, you need to make sure that you contact medical help and get assessed immediately. Most of these cases will be self-limiting and mild, and with standard treatment, which sometimes requires monitoring in hospital, everybody seems to get better. There are not really any cardiac conditions that preclude you from having the Pfizer vaccine. However, please speak to your cardiologist or your GP if you've either had myocarditis or pericarditis within the last 6 months, or you've currently got acute rheumatic heart disease, or you have endocarditis, or you're under 30 and you've got dilated cardiomyopathy, or you have severe heart failure, or you are a heart transplant recipient. Now, as we know, the COVID vaccine is 80 to 90% effective against symptomatic infections. However, this means that there is still a very small chance of potentially catching COVID-19 infection and potentially passing it on to someone else. Therefore, if you develop any symptoms, in particular upper respiratory tract infection symptoms like cough, shortness of breath, sore throat, or a fever, it is still important to get tested for COVID-19 and also follow your public health authorities' directions in terms of isolation or stay-at-home orders, social distancing and hand sanitising. If you have any further questions about any of the COVID-19 vaccination material, then please speak to your vaccination provider or your GP. Happy vaccinating!